You know that feeling, right? That nagging stiffness after an injury, or how slow recovery can feel after surgery. It almost feels like your own body is fighting against you. But what if I told you the key to healing isn't just rest, but actually the exact opposite? In this explainer, we're going to dive into the science of why simple, controlled movement is one of the most powerful tools we have for recovery.
Think about it. Whenever you have a stiff shoulder or a sore knee, what's your first instinct? It's usually to just stop moving it, right? To protect it by keeping it perfectly still. But what if that instinct is actually working against you? What if controlled, gentle movement is the real secret to a faster, better recovery? Well, let's find out why.
The answer to that question, the whole secret, really, comes down to a fundamental concept called range of motion. It's the framework that physical therapists use to literally guide the healing process. So today, we're going to break down exactly what it is, how it works, and why it's so incredibly critical for getting us all back on our feet. Let's get into it.
Okay, first things first. Before we can really get into the benefits, we need to be on the same page. So what exactly is range of motion?
At its very core, range of motion, you'll hear it called ROM for short, is simply the full potential movement of any part of your body. Think about bending your knee as far as it can go or making a big circle with your shoulder. But here's the really crucial part. That movement isn't just happening in the joint. It creates this cascade effect that touches everything connected to it, your muscles, your ligaments, even your blood vessels and nerves. It's a total system event.
And to really get it, you have to understand that ROM has two key parts. First, there's the joint range. That's what we usually think of, right? How far a bone can move, like flexing or extending. But just as important is the muscle range. That's all about how far a muscle can stretch out and then tighten back up. For truly healthy movement, you need both of these working together perfectly.
And to get a little more specific, therapists use this term called functional excursion. It sounds complicated, but it's not. It's just the total distance a muscle can travel, from its most stretched out point all the way to its tightest, most contracted point. Understanding this is key to designing exercises that keep a muscle healthy and capable of doing its job.
Okay, so now we know what ROM is, but how do we actually use it? Well, let's look at the three distinct ways therapists put it into action to kickstart healing. The three main types are passive, active, and active-assistive. And, the main difference between them really just boils down to one simple question. Who, or what, is doing the work? Let's break each one down.
So first up, we've got passive ROM, or PROM, and the name says it all. Here, your muscles are completely relaxed. You're doing basically nothing. The movement is created entirely by an outside force. That could be a therapist gently moving your arm, a special machine, or even you using your good arm to help your injured one. This is often the very first step right after an injury or surgery.
Next, we flip the script completely with active ROM, or A-AROM. This is the total opposite of passive. Here, you are doing all the work. The movement comes 100% from your own muscles contracting and moving that joint through its range. This is a huge milestone in recovery because it means you're starting to rebuild strength and control. And finally, there's the perfect middle ground, active-assistive ROM. This is for that phase when you can start the movement on your own, but your muscles are just a little too weak to finish the job, especially against gravity. So an outside force, like a therapist's hand or a piece of equipment, gives you just enough of a boost to complete the full motion. It's the perfect bridge from passive to fully active movement.
Okay, so we've covered the what and the how. But why? Why do these exercises? Let's look at the specific goals for each type and, probably most importantly, the number one safety rule you can't ignore.
When we're doing passive ROM, it's all about playing defense. We're not trying to build strength here. The main goals are to keep the joint from getting stiff, to prevent the tissues from shortening up into painful knots, and to gently boost circulation, which brings nutrients to the joint. It's all about creating the perfect environment for healing to begin.
But once you can move on to active ROM, the game totally changes. Now we're on offense. Because your muscles are firing, you're not just maintaining mobility anymore. You're also keeping your muscles elastic, sending crucial feedback to your brain, and even stimulating your bones to stay strong. Plus, that muscle pump is way better at boosting circulation and preventing dangerous blood clots. The benefits just multiply.
And this brings us to what is maybe the most important takeaway of this whole thing. Range of motion is medicine, but the dose has to be right. It should never be done if the motion is actually hurting the healing process. And trust me, your body will tell you when you're overdoing it. The big warning signs are a sharp increase in pain or signs of inflammation, like more swelling, heat, or redness. The golden rule is simple. Always listen to your body and work within a pain-free range.
So, that's the theory. But what does this look like in the real world? And, more to the point, how can you get involved in your own recovery? Let's see how we put this all into practice.
Now, this isn't just about randomly moving a limb around. It's a very precise, careful procedure. A therapist always starts by evaluating you. Then, they'll make sure you're positioned correctly for comfort and stability, they'll support the limb so there's no extra stress, and then they'll move the joint smoothly and rhythmically, always stopping at the first hint of pain. And the whole time, they are watching you, monitoring your response.
And here's where it gets really empowering. You can take the driver's seat in your own recovery through something called Self-Assisted ROM. This is where you learn to use your own body or some simple tools to perform these vital movements yourself. It's a fantastic way to protect healing tissues while still getting all the benefits of motion.
And you don't need a bunch of fancy, expensive equipment either. The most common tool is you, using your other arm or leg. But therapists get creative. They might use a simple stick or a T-bar for guided movements, have you climb your fingers up a wall, or use a simple overhead pulley system. Heck, even a skateboard on the floor can give you a nice friction-free surface to slide your foot back and forth.
All right, let's bring it all home. To wrap this up, let's look at one really cool, high-tech application of these ideas and summarize why movement is just so fundamental to our health.
Check this out. This machine is the ultimate expression of passive ROM. It's called a continuous passive motion, or CPM machine. After a big joint surgery, like a knee replacement, a patient's leg might be placed in this device. And for hours at a time, the machine will slowly, gently, and continuously move the joint through a very specific range of motion, all without the patient having to lift a finger.
And this isn't some newfangled gimmick. It's based on decades of foundational research from pioneers like Dr. Robert Salter, who scientifically proved the profound healing effects that this kind of gentle, continuous motion has on our joints.
So what does all that motion actually do? Well, the benefits are huge. CPM is proven to help prevent scar tissue and stiffness from setting in. It enhances the healing of soft tissues like tendons and ligaments, and it improves the joint's natural lubrication. For many people, this all adds up to less pain and getting their full range of motion back way faster after surgery. It's a perfect real-world example of movement as medicine. So the takeaway here is pretty clear, right? Whether it's a high-tech machine doing the work or just you gently moving your own arm, controlled motion is an incredibly powerful force for healing. And that leaves us with one final thought to chew on. We've seen how vital range of motion is for recovery. But how much of your full range of motion are you using every single day? And what could you gain by mindfully exploring it starting today? Thanks for watching.